Have you experienced or are currently experiencing chronic knee pain? Well, don't live in pain because there is help for you. Madeira Chiropractic Wellness Center is sponsoring this segment to share more about their non-surgical knee pain problem. Dr. John Madeira joins me now. Doctor, thanks for coming back on. We appreciate it.
Yeah, glad to be here.
All right, well, start by telling us the most common cause of chronic pain.
Well, the most common cause of chronic knee pain is osteoarthritis, which is more commonly known as wear and tear arthritis. And it's when the cartilage inside of a joint wears down to a point where it begins to affect the alignment, begins to affect the nerves, causes a lot of pain.
Yeah, and you'll know it, I'm sure, if you have it. So we have an image that shows the stages of an osteoarthritis knee. So talk to us about this.
So this shows the 4 stages of osteoarthritis or wear and tear arthritis. This, of course, is normal. You can see the alignment is good. And over time, as we age and because of chronic injuries and sports injuries and things like that, the cartilage starts to wear and break down.
Yeah.
And it begins to create all kinds of common problems. The problem is that you don't get a knee replacement until you get to that point. And there's a really big gap of time between when the problem starts and when you can have that done.
All right, yeah. So now you have a few x-rays to show us, starting from a normal knee, an abnormal, then a severe knee. So let's start with what a normal one looks like. This is the x-ray now.
Yeah, so we're looking at this person from the front, just like you're looking at me. So this is the right knee. What I really want you to see is the space here, and it's even on both sides. Also, I want you to notice the alignment, how nice and straight it is.
Yeah.
If we go to the next one, you'll begin to see some differences. So this is, look at the difference here now. You see that this gap is closing. This one's even worse. You see all this whiteness, that's all osteoarthritis. And now it's not bone on bone, but you can see that there's space there. But look at the alignment, especially in this knee. You see how that happens?
You can really tell.
Yeah.
That is the point you don't want to get to.
Yeah, and there's one more I'd like to show you here too.
Yep.
So this one is really bad. And so this is the point where they're going to want to replace your knee.
Okay.
But we're trying to fill the gap between when people start having these problems and they have to get to that point.
Right, so you're not living with that pain.
Exactly.
And one of the ways that you can help with chronic knee pain is this knee on track distraction session. So what is that exactly?
So we use a combination approach. In other words, we approach it from different aspects. But the one thing that we do is there's a common problem with the alignment. When the alignment gets bad, this knee on track distraction helps to realign the knee.
Okay.
And it helps to a thing called patellar tracking problems where the knee cap doesn't stay in its groove when you bend your knee, and that can be very painful. Second most common cause of knee problems.
So now the question I'm sure everybody's asking at home is how soon after working with a patient can they actually see results, and can that pain improve?
Yeah, well, almost always, not always of course, but almost always within 5 or 6 visits people are starting to see improvement.
Yeah.
Again, it takes a while because it's a long-term problem.
And it may depend on the patient, I'm sure, as
Certainly,
well.
yes.
Bone-on-bone arthritis is a term that's often used by surgeons. Why is that, and what does that mean?
Well, bone-on-bone arthritis is just a description that surgeons use to help a patient understand that the cartilage is nearly completely gone. You couldn't walk on your knee if it was actually bone-on-bone, but it indicates the seriousness of the problem. That typically is knee replacement time.
If folks are experiencing this type of pain or chronic pain, how can they reach out to you?
Well, the easiest way is just to contact our office in Hershey. It's 533-6100, area code 717, and our web address is madchirowellness.com.
That's awesome. Well, thanks for your time today. I feel like I learned a lot, so we appreciate it.
Yeah,
and there's the information if you want to reach out. As we go to the break, we do want to thank Madeira Chiropractic Wellness Center for sponsoring this segment. More Good Day PA is next.